Thank you, sir. Next, I would like to invite Dr. Raza Siddiqui to say a few words.
Thank you very much, especially Dr. Karthik, for giving this opportunity to be with this gathering and luminaries of the industry. Today, all healthcare professionals, we are in one of the most interesting times of our lives, because the way healthcare is being delivered today is going to totally transform in next to 5 to 7 years. But today we have some serious issues where the healthcare industry and academia can work together and find meaningful solutions, and that is the subject of perhaps this gathering today. There are 5 issues which are very serious issues which all of us in healthcare industry internationally are facing. Number 1 is aging population, burden of chronic diseases, cost of healthcare going up, insurance has a challenge of controlling the price, and over and above, shortage of skilled manpower. And I think the only solution is technology as an enabler. And if we can do so, we can find meaningful solutions and offer cost-efficient solutions. I'll give you an example. In healthcare industry, in delivery of healthcare, the cost of healthcare, the major component is skilled manpower, which is almost 40 to 50%. So we have to find ways, innovative ways to optimize and maximize on this resource. If you see today, a physician, which is the most expensive resource, spends 60% of his time in entering EMR. Patient has gone to see the doctor, wants to have eye contact, but doctor is not able to maintain eye contact because he is looking at you and he is going to the computer, he is looking at you, then he is going back to computer. Patient is in dilemma whether he is really looking at me or is entering something else. Now with technology, we found solutions. We found solutions in technologies which are fashionable to talk about in conferences, but real use is really good. If we talk of use of generative AI here, which we have brought in our institute in Ras Al Khaimah, RAC Hospital, by the use of generative AI, the 60% of doctors' time is saved. And whatever is being discussed between the patient and the doctor is being captured by generative AI on a set template. So you are able to save 60% of doctor's time, which is the most expensive resource for the institution. Second most important resource and a rare resource is nursing. Today, nursing are doing 60%, 70% of the job which is non-nursing. All the basic needs of the patient are being done by them. With the help of AI, with the help of sensors, and with the help of new nurse call systems, which I have seen in Medcare Hospital, and I was impressed, and I went to your Medcare Royal Hospital, and we saw that, and we are also using that. 50% of the nursing time is saved. So if we are able to do that, we are able to save 20% cost of running our institution, thereby make healthcare affordable to the people. Now, coming back to the synergy, I'm also on the board of Ras Al Khaimah Medical Health and Science University. And I'm also one of the founders, fortunately, of that institution. And when we talk about this to the leadership team there, we realize that we are producing doctors of yesterday. We are not producing doctors of tomorrow, because doctors who are being produced have to be familiar with the technology language which we are using today. But when they come out, they have to be re-inducted, educated into this so that they are able to help this. So we have also done that, and we have a good synergy with the academia. And this is perhaps for the first time we have introduced Metaverse Lab in Medical Institute. So today the entire simulation is being done in Metaverse Lab already in Ras Al Khaimah. Virtual ER environment is created, patient is triaged, all the diagnosis is done, treatment is done, and the students are exposed to the latest ultimate technology use. So when these students, this is one example, it is very important that we work together and have synergies and have the students come up for future. For example, all the medical people know here, first 2 years, Grey's Anatomy we have to carry, but time has changed now. You don't have to memorize. You have to develop students who have the ability to make best use of the information available at a click of a button. These are some of the reorientations we are doing in the institution. Coming back to the new healthcare models, we are trying to develop the smartest hospital of the world in Ras Al Khaimah, and hopefully with the help of ecosystem and Almighty God and support of leadership we'll be able to do. So what we are trying to do is best of IoT, IOMT, best of blockchain, best of big data, best of big machine learning, and on top of it AI. Imagine a hospital that you are sitting at home and suddenly you have pain in abdomen, you go to mobile app and your entire journey is taken care of. You are driven, your parking lot is reserved. From parking lot, you directly walk into the doctor's chamber. On the way, your appointment, your insurance approval, your payment gateway, everything is taken care of. You go to a futuristic smart consult room, which is equipped with all the latest technologies, and with the help of IoT, all the data is available. You have a smart interactive screen where your doctor takes you through entire process and explains you and guides you. On a click of a button, your diagnosis is made. On top of it, AI tells you that certain 100 cases have been treated with this protocol and outcome has been 100%. So we are going to have this in future, and this is not far. This is going to happen in next 2 to 3 years, but important thing is that all of us as an ecosystem work together. Healthcare providers, academia, institutions, research institutions, everybody works together and enjoy the interesting times which are going to happen in next 5 to 7 years. Thank you very much.